Well, welcome everybody to the first webinar of 2026 on this very snowy day. Hoping our technology will cooperate as we're all working from home instead of in the office. I am Dara Lee Lewis, cardiologist at the Lown Group, and I am thrilled to have with me today two of my colleagues, primary care physicians from Lown, Doctors Harley Simeone and Lilian Mahrokhian. And they're going to talk with us today about takeaways from the American College of Lifestyle Medicine conference and how we can use lifestyle medicine to improve our health. So take it away.
Okay, hi everyone. I'm Lilian Mahrokhian, and I just want to welcome everyone. And also, I hope everyone's staying safe and warm. Harley and I are excited to talk today about things we can all do to improve our health and health trajectory. As Dara said, we attended the American College of Lifestyle Medicine's annual meeting this past November 2025 in Dallas, Texas. And what we will share with you today is the fundamentals of lifestyle medicine, the 6 core pillars of lifestyle medicine, and provide practical advice to empower you to improve your health. So what is lifestyle medicine? Lifestyle medicine is a medical specialty that uses evidence-based lifestyle interventions as a primary way to treat, prevent, and often reverse chronic conditions like cardiovascular disease, type 2 diabetes, and obesity. These interventions fall into 6 broad categories or pillars. We will talk mostly about nutrition and exercise, and if time allows, and I think it will, we'll touch upon sleep. I will briefly review the other 3 pillars, which are avoidance of risky substances, stress management, and social connection. So some statistics. Several risky behaviors illustrated here in the dominoes significantly contribute to 15 chronic conditions, which make up 80% of our healthcare costs worldwide. These risky behaviors include poor diet, physical inactivity, smoking, poor stress management, social isolation, insufficient sleep, and excess alcohol. So listed in gray are the 15 chronic conditions. There is a chronic disease epidemic in the US. 6 out of 10 adults have 1 chronic disease, and 4 out of 10 have 2 or more. Nearly half of US adults have some form of cardiovascular disease, and 1 in 3 adults have prediabetes, and 80% of them don't even know it. So how do we manage these? This slide illustrates the paradigm shift in medicine. So allopathic traditional medicine focus is on evaluating symptoms as they present and diagnosing a condition or a disease, treating these conditions with medications or surgery, and then managing symptoms. However, lifestyle medicine's focus is on recognizing the shared mechanisms of illness rooted in our lifestyle and provides lifestyle-focused care with a goal of preventing the illness before it presents, or treating and reversing illnesses with a lifestyle-first approach. So let's now talk about some of the pillars: social connection and stress management. So in 2023, the US Surgeon General's advisory titled "Our Epidemic of Loneliness and Isolation" declared loneliness as a public health crisis, stating that 1 in 2 adults experience measurable levels of loneliness, posing health risks as dangerous as smoking 15 cigarettes daily. Isolation is associated with increased morbidity and mortality, and prioritizing our social connections and community functions as an actual treatment. This not only includes our personal relationships, but also our relationships with pets, the natural world, and spirituality. Chronic stress, as we all know, leads to impaired health and productivity. It can lead to anxiety, depression, cardiovascular disease, and immune dysfunction. So here are some strategies to manage stress. Management includes mindfulness-based practice, relaxation techniques, and effective time management, to name a few. So mindfulness-based practices reduce stress by promoting present moment awareness in daily life, taking you out of thinking about the future and the past and really keeping you present in the moment. Relaxation techniques include parasympathetic breathing exercises like box breathing and 4-7-8 breathing. And managing time wisely reduces stress and creates time affluence and results in a better work-life balance. So we spend more time doing the things that we enjoy. So another pillar is avoidance of risky substances. So although this graphic is showing healthy habits like exercise and a green smoothie, it is listing the basic things we need to avoid, including tobacco use, alcohol use, and other harmful substances. So not smoking or quitting smoking prevents numerous diseases, not only those impacting the lungs. Moderation of alcohol use protects our liver and reduces the risk of a variety of cancers. So 2025 marked a new advisory on alcohol use. In January of 2025, the US Surgeon General issued a new advisory highlighting a direct link between alcohol consumption and an increased risk of at least 7 types of cancer, identifying alcohol use as a leading preventable cause of cancer, concluding that there is, quote, no safe level of alcohol use. So previously we used to say 7 drinks per week for women, less than 14 drinks per week for men. But there has been a shift, and now we really recognize that moderation and reducing alcohol consumption is really the goal. On the right, there are other toxins that we're exposed to in our air, water, and soil, and in our everyday life. This is a bit harder to control, but there's conversations happening about things like microplastics and forever chemicals. Okay, I'm going to turn it over to Harley to talk about nutrition.
Thanks, Lillian. Before I start talking about nutrition, I just want to say how happy I am to be here discussing these topics. I've had a personal interest in lifestyle medicine really since high school, and I've been so fortunate in the last year since joining the Lown group to be able to take a deeper dive into learning more about this important topic, starting with going to the conference with Lillian in November, and now also having the time to talk to my patients more about how to integrate the lifestyle medicine pillars into their lives. So this is really exciting for me, and thank you all so much for joining today. So, what does the ACLM recommend that we eat? I love this quote by Michael Pollan: "Eat food, not too much, mostly plants." It's from his 2008 book, In Defense of Food. And really, the American College of Lifestyle Medicine promotes an eating pattern based on minimally processed vegetables, fruits, whole grains, legumes, nuts, and seeds. So, in other words, a whole food, plant-based diet. The goal is to have 30 or more different types of plants every week, and research supports many benefits and really very few drawbacks from this diet. Adopting this diet helps reduce the risk of many of the chronic diseases we saw listed earlier in the presentation, and in some cases can even help reverse disease. By making plant-based nutrition the mainstay of your diet, you are in turn also minimizing ultra-processed food intake, and that includes red and processed meats, saturated fats, added sugars, and excess sodium. I also just want to mention I'm mostly discussing how plant-based diets affect your individual health, but something to keep in mind are the significant environmental benefits seen with reducing animal product consumption. So raising livestock for consumption produces significant greenhouse emissions, utilizes a lot of land and water, and even a small reduction and shift towards a plant-based diet can significantly reduce pollution. So just something to keep in mind from an environmental standpoint. I'm going to touch on 4 of the chronic conditions that we mentioned earlier and show some support as to how plant-based diets can impact these diagnoses. So the first one is cardiovascular. Multiple studies have shown that adopting a plant-based diet reduces the risk of developing heart disease. A large review in 2021 with 700,000 people showed a 16% lower risk of cardiovascular disease in those who have a plant-predominant diet. Studies looking at outcomes in people who follow a vegetarian versus a meat-based diet show a 24% lower death rate from heart disease in the vegetarian group. Additionally, it is the only diet really shown in studies to reverse atherosclerosis, which is the arterial plaque that builds up in the coronary arteries. So there was actual reduction in that buildup when you adopt a plant-based diet. The next condition significantly affected by this diet is cancer. So I went to a whole workshop at this conference on cancer and how the 6 pillars of lifestyle medicine really affect cancer diagnosis, prognosis, and recurrence. So this is just scratching the surface, but diet is no exception. There was one study showing a 35% lower risk of prostate cancer in men who followed plant-based diets. And there are a lot of different examples showing not only reduction of risk of cancer, but if you are a cancer survivor, a decreased risk of recurrence and just quality of life improvements. So cancer is definitely affected by the lifestyle medicine interventions. The next condition is cognitive decline, which includes Alzheimer's disease and mild cognitive impairment. So the MIND diet, which is referred to here, stands for the Mediterranean Dash Intervention for Neurodegenerative Delay. And it's essentially a plant-based diet with the addition of fish and lean meat. So similar, but a few extra items in there. Dr. Dean Ornish, who many of you have probably heard of, spoke at the conference and presented some really impressive results from his recent study. So the study implemented the 6 pillars of lifestyle medicine in an intensive 20-week intervention in patients who had developed signs of cognitive impairment. And in this study, 46% of people showed improvement in the test measuring memory, judgment, and problem solving. And another 37.5% showed no cognitive decline or change. So 83% improved or maintained their cognition during the 5-month program. So really impressive results in that study. Dr. Sanjay Gupta presented these findings in a CNN documentary from July of 2024. So if you have access to that, that's a really interesting bit that he did about the findings of the study and interviewing the patients that were involved. So the last condition I'll just touch on with regards to nutrition is infection. So moving toward a plant-based diet was associated with a significantly lower risk of moderate and severe COVID-19 and also lower rates of influenza and pneumonia. So how does this all work? Why does eating plants lead to a reduced risk of all these different chronic conditions? The answer is your gut and specifically your microbiome. So the lining of your intestines is a very active, ideally very diverse system. And the more diversity seen indicates a healthier microbiome. So if you are feeding your gut with the foods that promote this diversity, it provides your body with an amazing barrier of protection. So bacteria, gut barrier, and the immune system are all functioning together as one integrated system. And as you can see on the right-hand side of this slide, this unhealthy gut microbiome environment, there are lots of cracks and gaps, and this is allowing toxins from the intestines to enter your system and leads to systemic inflammation and basically is triggering the body to believe it's under attack. And so your immune system is overreacting and inflammation results. So the fewer inflammatory markers that are triggered, the more at peace is the immune system and the less inflammation you have. And that is what is contributing to the lower rates of all these chronic conditions. That's kind of a simplified version, but it's essentially what we're seeing. And so it's important to know how to nourish, build, and protect this microbiome. The 4 main groups of foods that will optimize the microbiome are shown here. So one is fiber, as seen in the last slide, lentils, berries, chia seeds, chickpeas. Fiber is very important. Polyphenols is the second one, and this is what gives produce its vibrant colors. So, all the colorful vegetables and fruits we're eating have polyphenols in it, and they also have the added benefit of directly inhibiting inflammation, polyphenols do. So, two benefits from that. Healthy fats, such as those found in avocado, walnuts, and fish, if you eat fish in your diet, is another beneficial factor for the microbiome. And then the fourth is fermented foods. So sauerkraut, sourdough, tempeh, kombucha, these all contribute to a healthy gut barrier. The majority of Americans do not get nearly enough fiber on a daily basis. So the goal is 25 to 30 grams of fiber. There's some examples of ways to get that. I was thinking of, I can show you a few examples of products that I have here after we stop screen sharing, but, a breakfast that would include mixed berries, Greek yogurt or vegan yogurt, some walnuts or nut butter, and then sprinkled on top of chia seeds I can show it after, but I have the super seed trio with chia, flaxseed, and hemp, which would be a good way to incorporate all these four, real powerhouses to help the microbiome and get enough fiber. So that's one option. There are fiber supplements. There's psyllium husk, which I have an example here as well. Sometimes it can look and taste a little like sawdust, but you can get used to it, and it really is very good for your gut health. So making sure you're getting enough fiber is really important. The other thing just to think about is that by eating a diet really rich in whole foods and predominantly plant-based, what you're not getting is then the ultra-processed foods. So ultra-processed foods are the ones seen in the middle aisles of the grocery store. They're heavily processed. They've gone through multiple stages to make them into the form that you see on the shelf. They have a negative impact on the gut microbiome. They can usually be eaten very quickly. They're missing the vitamins present in whole foods and tend to lack fiber. So you don't feel as full, you don't have that satiety, and then you end up eating more calories throughout the day, resulting in weight gain. So, really switching one for the other is helpful for many reasons. Some practical and good tips is that the majority of the foods that are promoted in this plant-based diet are found at the perimeter of the store, so where fresh produce lives. And Michael Pollan, who had the quote I mentioned at the beginning, also had the tip that he would only eat things that his grandmother's generation would recognize as food. So, these ultra processed things in boxes and containers that just, to him didn't qualify as real food. But the perimeter is where you'll find the best options. And then batch cooking or preparing foods in advance in larger amounts is a nice way to ensure that throughout the course of the week, when you're having less time to prepare, think about foods, you're not grabbing ultra processed food as a last minute solution. And then to just tie in the other pillar of social connection, eating with others has been shown to encourage healthier food choices. So that is what I wanted to say about nutrition. For now, like I said, there were 4 days of lectures about all this, so this is just scratching the surface. But I don't know, Dara, if you wanted to bring in questions now, or we can move on to physical activity.
So much here to think about and talk about. Let's do this. Let's keep moving. But I will invite, we have almost 100 people on our audience, so I will invite people to enter their questions in the Q&A. And then I definitely want to see those examples of the fiber supplements you have and hear a little bit more about how you work this into your own lives. But maybe we'll finish first and come back to the questions. But anyway, anyone who's in the audience, I welcome your questions. You can either put it into the chat or the Q&A. And then we'll just keep going for now.
Okay, sounds good.
Right. Okay, so I'm going to talk about exercise, a very favorite topic of mine for people that know me. So let's do a deeper dive and talk about why movement matters. I think there's no debate on the benefits of physical activity. It helps you stay healthy. It helps you stay independent as you age. It reduces the risk of heart disease. It builds and tones your muscles. It improves your strength. And this in turn lowers your risk of falls and injury. Cardiovascular exercise releases endorphins, improves mood, reduces stress and anxiety, and exercise also helps us maintain a healthy weight. So one of the lectures at ACLM was dedicated to just reviewing the physical activity guidelines that were put out in 2018. So these guidelines were drafted, and this is a second edition. So they said likely the next one will be in 2028. They're put out by the Office of Disease Prevention and Health Promotion with the help of a dedicated advisory committee of experts. And these guidelines are for all adults over the age of 18, and specifically emphasizing two types of exercise, so aerobic or cardiovascular exercise and strength training. So the recommendations for aerobic exercise are 150 to 300 minutes of moderate intensity cardiovascular exercise per week, which is the equivalent of about 2.5 hours per week, or 75 to 150 minutes per week of vigorous exercise, which is about 1.25 hours per week. And for strength training, the guidelines are to do 2 or more days of moderate intensity muscle strengthening activity for all your major muscle groups. So where are we currently in the US in meeting these recommendations? This slide illustrates that we have work to do. So 47% of US adults met the guidelines for aerobic exercise, 31% of adults met the guidelines for muscle strengthening, but less than 25% of Americans meet both. So here in this illustration, we see cardiovascular aerobic exercise. So what is moderate intensity and what is vigorous intensity, and how can we tell what we're doing? So how we determine this is we can use the concept of RPE, or rate of perceived exertion. So this is a 1 to 10 subjective scale of exertion. So for moderate intensity, this is where your respiratory rate starts to increase, but you can still talk while you're doing the exercise and hold a conversation, and you know you can exercise for a longer period of time. For vigorous intensity, this is when it's difficult to exercise and speak in sentences at the same time. So this basic concept helps you determine how intense you're exercising and if you are where you should be regarding cardiovascular exercise. And what about strength training? So the goal here is at least 2 days per week of strength training. So you can start with one set, which is 8 to 12 reps for each muscle group, 2 times per week, and then progress to 3 to 5 sets per each muscle group per session. So weekly, this is a total of 6 to 10 sets per muscle group. You can do this using body weights, resistance bands, free weights, machines. And the diagram on the right really shows all the major muscle groups that we're trying to think about and target. So for your legs, you want to target both quads and hamstrings. Your hips, you're targeting glutes, your back, your lats, your pecs, your abdominals, deltoids, triceps, biceps. You get what I'm saying. So this can seem complicated. Sounds like a lot to do, but you can simplify your strength exercise by doing compound movements that target multiple muscle groups at once. So for example, a vertical push, so a shoulder press or vertical pull, a lat pull down targets your shoulders, your backs, and your arms. Horizontal push, which is a chest press, or horizontal pull like a row, target also your chest and upper back. You can do things like deadlifts, targeting your glutes and hamstrings, and squats that target your quads and glutes. And what about the effort? So the recommendation includes moderate intensity strength training. And how do you know how much weight to lift? So your goals are to make your muscles do more than they are accustomed. And it needs to be hard enough to result in improvement in strength, power, and muscle mass. So here we can use the concept of reps in reserve. So you ask yourself, how many more reps can you or could you do at the end of a set? And that is your reps in reserve. So if the end of a set, you could have done 5 more easily, then the weight is too light. For moderate intensity strength training, you want to aim for about 2 to 4 reps in reserve. So another way to think about this is you should be needing to slow down towards the end of your set if your weight is at the right amount. Okay, so putting this into practice, what can we do as your provider in the office to help you? So one, we can take your physical activity vital signs, which means we ask you, what are you doing? How many days per week are you doing cardiovascular exercise? How many minutes per session? How many days are you strength training? And then here we can create your prescription for exercise. We can also assess your current level of fitness. You can do home tests like test your grip strength with something called a dead hang, or see how many push-ups you can do, or see how long you can hold a body weight squat. You can also partner with a medical fitness professional who can test your basic strength and mobility in the office. And we can measure your level of cardiovascular fitness with a CPET level 1. So this is a cardiopulmonary exercise test, level 1, that's done by our exercise physiologists at Lown. And it measures something called VO2 max, which I think a lot of people hear about. And this measures your cardiovascular fitness to see where you are for your age and gender. So here is a spotlight on the benefits of exercise in a specific condition like menopause. So exercise has numerous benefits, specifically for the postmenopausal woman, even before that woman is considering menopausal hormone therapy. So exercise reduces percent body fat, it increases bone health, it improves glucose metabolism, it reduces hot flashes, it improves mitochondrial function and energy, and moderate intensity aerobic exercise reduces depression and anxiety. And so for implementation, in summary, we follow a tiered approach. We can refer to a physical therapist for patients with physical deconditioning or muscle loss, which we also call sarcopenia. For the beginner, we can consider a personal trainer or an exercise physiologist to help teach the skills and proper technique and design a program specific to that patient's preference. And for the person who's an active exerciser, we can review and fine-tune and support them for maintenance and progression. So in conclusion, for exercise, it's never too late to start, and small changes have big impacts. So don't look for perfection in keeping with these guidelines.
Great. And then I can move on to sleep unless, Dare, you wanted to break here for questions or whatever is best.
No, let's keep going because the questions are actually starting to pile in, but we'll save them for the end. So let's hear about sleep. Thank you.
Okay. So, sleep can be quite elusive, but I think we all know how important it is. So, 7 to 9 hours tends to be the recommendation for duration of sleep we should aim for on a nightly basis. A lot happens during this time. There's physical repair of our bodies, there's memory consolidation, which helps us with our learning abilities, and then emotional regulation. Like we all know how we feel when we're lacking sleep in terms of our ability to deal with different things that come up. And then, not getting quality sleep can lead to various health problems and decreased sense of well-being. So obviously very important, but easier said than done. In addition to just feeling good, immune system really is affected by sleep. So if you get enough sleep, it allows your immune system to really fight infections better. And then that word inflammation that keeps popping up, there's more inflammation in people who are sleep deprived. And like I said, cognition and mood and memory are all affected by sleep. So obviously we know it's important, but it's easier said than done. And people develop a lot of habits or bad habits usually when it comes to trying to get sleep because it doesn't come easily. So there are some, basic sleep hygiene checklists. So, the environment should be cool, dark, and quiet. around 66 to 68 degrees is where you want to keep your bedroom, ideally for sleep optimization. Don't be laying in bed, doing things that are not sleeping, like watching TV or anything else, because then your body is training itself to not sleep in your bed. So no screens or work in bed, ideally. Maintaining a regular schedule. We all have heard this, but even when you don't need to wake up at a particular time because it's a weekend, it's good to try to maintain that general schedule. And then eating and drinking before bed can really disrupt sleep. So, one of the presenters mentioned, you shouldn't really have any calories within 3 hours of going to sleep because of the way it affects glucose and cortisol and then inhibits sleep and affects melatonin as well. And also just fluids in terms of getting up in the middle of the night to use the bathroom, limiting fluids 2 hours before bed. The other one was caffeine. There people metabolize caffeine at different rates. And even some people, if you have caffeine in the morning, it can still affect you later on, even when you're trying to go to bed many hours later. So if you're sensitive to caffeine, adjusting the amount you're drinking if you're having trouble sleeping can be helpful. Similarly, alcohol makes people feel tired. A lot of people use it to try to go to sleep, but it is an activator kind of several hours later. And so you might fall asleep better if you've had some alcohol, but then later in the night, you're waking up. It affects your body temperature regulation. And so it is not conducive to good sleep, unfortunately. And then the other is related to anxiety. So kind of watching the clock is detrimental. It's really anxiety producing. Our minds start to race in the middle of the night and you start to panic if you are seeing that clock tick later and later and not getting to sleep. They had this kind of analogy of this splinter effect where if you get a splinter in your hand and it starts to become infected, you could put a Band-Aid on it, you could take antibiotics, you could drain it, but really removing that splinter is the way to treat it the best. And getting to the core of the sleep problems is really the best way to then fix sleep rather than medications or other interventions that are more band-aids than getting to the root cause. So similar to what I just mentioned, if you're getting up to use the bathroom, limiting fluids, and then the racing mind is really a big thing. In the middle of the night, worries and problems seem much bigger sometimes. And so getting into ways to reduce that is really helpful. They had some examples, there's things like body scanning where you're kind of moving your anxieties away from thinking and into your physical body. So feeling different parts of your body and paying attention to how you physically feel. Gratitude practice is kind of thinking about the things you're grateful for, people that you're grateful for and why. And then this parking lot theory of like taking your worries and parking them until tomorrow and not having them take the main stage in your mind when you're worrying in the middle of the night. A lot of these are things that are addressed in cognitive behavioral therapy for insomnia or CBTI, and that's it's hard to find sometimes a therapist who specializes in that, but there are some around. There are some online sites which we can, send you after this talk. And also a lot of apps now that are addressing the CBTI. So a lot of different methods have been tried, but I think just coming up with one that is specific for sleep, there's a lot of ways that we try to treat anxiety cognitively as well. It's important to have a separate method for sleeping because if you're using the same techniques you're using to treat other anxieties, then they become linked in your mind and you kind of want a separate one just for sleep. So coming up with one for that is helpful. There are breathing techniques, the 4-7-8 breathing, which is inhaling for 4 seconds through your nose, holding for 7, and then exhaling through your mouth for 8. That's one technique some people use for breathing. The other one is the 4-4 pause, which is you breathe in for 4, then out for 4, and then you pause, and then you start that again. It calms the nervous system by focusing your attention on breath. So, we've all heard of these different breathing strategies, but they are helpful. If you can come up with one that's really what you do when you're having trouble sleeping, that can be helpful. Um, So that was really all I had on sleep because I know it's a big topic. There was a 3-hour workshop I went to, but, I just wanted to kind of talk about in general how the best way to treat sleep is through the cognitive behavioral therapy for insomnia. And, that I didn't even mention things like sleep apnea and there's some sleep disorders. So, addressing any of those symptoms and talking about that with your primary care doctor is always a good idea. But just to kind of tie it all together, all these pillars are interconnected. You need activity in order to sleep, and you need, sleep in order to control your appetite, and you need nutrition to help for your activity. So everything it plays upon itself and each other. And so, one area of focus at a time really naturally helps all the others. So if it seems daunting or like a lot to take on, it's really, one step at a time. We're looking for progression, not perfection. And even small changes have impact. And very few people actually follow a fully, dedicate all these pillars and follow a fully healthy lifestyle. So there's a lot of room for improvement, small steps. And, one pillar making a small change every week, every few weeks can make a world of difference. We're here to help you with all of this. As primary care doctors, cardiologists, we are your thinking partner. So we're happy to come up with a good plan for everyone in terms of how to feel your best and really take control of some of these things. And not everything is right for everyone. So you really have to ask, is this right for me? Um, but knowledge is power. So that is what we wanted to enforce today. And Lilian, if you have anything else to add.
I think it's a perfect summary. I think, we also, as physicians, we're also patients. So we are thinking about all of these things and how best to implement them for ourselves and brainstorming ideas that we can share with our patients because, there's for us as well, there is always room for improvement.
This is so great. I think I've learned so much from my patients as well because I think each of us have sort of figured out tricks and strategies over the years when we're very busy, when we're very stressed and not sleeping well, when we might have young children who are picky eaters. Like there's times in our lives where it's really challenging to follow these, even if we do know what we're supposed to do. It's hard to figure out ways to do it. So I love that you show us how they interact with each other and that even focusing on one small thing can help the others to improve. Let me start with some of the questions that are in the Q&A, and some of them are pretty specific. But before we do that, Harley, did you want to show us some examples of fiber? Because there's a couple questions in here about fiber. Um, are fiber supplements okay? Something like Metamucil, does that count? It's hard to get enough fiber sometimes from our food. How
Mhm.
do you do it?
Yeah, good question. I mean, definitely optimizing the foods that have fiber. Lentils are a great source. This is one of the things I showed, which is, I don't know if you can see it, but it's this
Yep.
super seed trio. You don't have to do the Whole Foods brand, but something along these lines. For instance, one serving of this has 7 grams of fiber and 7 grams of protein. So sprinkling this on yogurt, putting in baking items, that can be a good source. This was the psyllium that I wanted to show. This is a very basic psyllium. It has no additives in terms of some of them have fake sugar, added sugar, flavors just to make them more palatable because it really doesn't taste very good. But if you this they come kind of simplified. I think anything that's going to force you to take it with full glass of water is important because fiber can act as kind of a cement if you're not flushing it through with plenty of fluids. So some of the pills or capsules have that risk. So you just want to make sure if you're doing those, you're taking them with plenty of fluids. But the soluble fiber seen in psyllium husk is the one that you would want to add if you're going to be doing a supplement like this.
Can you show us what it looks like? I mean, inside.
Yes.
You said sawdust, and I think that is what
Yeah,
it
it kind of
looks
looks exactly like sawdust.
like.
So yes.
They have this at Trader Joe's. They have it at Whole Foods for sure.
Mhm.
Psyllium is Metamucil, right? But Metamucil is the psyllium plus, as you said, orange flavoring and sometimes sugar or artificial sweeteners.
Mhm.
What I do with my psyllium I'm a psyllium fan, is I mix it into tomato juice or to my smoothie, like a little bit, and then drink some water. Because I think mixing just that in water isn't that, I mean, it's never going to be delicious, but
Yeah.
it's really yucky. How do you do your psyllium or your fiber, both of you?
I take this with mostly water, and I actually add a little bit of tart cherry juice just to give
Mm.
it a little flavor. And then I mix it really fast and drink it really fast. Because if you wait too long, it kind of solidifies and becomes a little bit gelatinous. But yeah, drinking it quickly is the best way to do it. So that's how I do. That's how I take it. But Lilian, I don't know if you take this too.
Well,
Haven't gone to that. I haven't gone to that stage yet of doing psyllium husk. I really am trying to get fiber in foods and pay attention to it and try and track it. So I do a ton of nuts and seeds, flax seeds, chia seeds, and then try and get, it in whole foods and vegetables. So, and some trackings, like my Fitness Pal will track the amount of fiber that you're getting. So you can always check in periodically and just get a sense of if you're meeting those targets of 25 to 30 grams. So,
are there any downsides of having too much fiber?
I think if you start too fast, you can definitely feel it from a GI standpoint with regards to some bloating and gas. So I usually tell people to start with a half or a quarter of what is suggested on the label and then build up slowly from there.
Sounds great.
Mhm.
One more on nutrition before we switch over to exercise. Someone asks, I struggle to eat fermented foods other than yogurt and sourdough. How much fermented foods do we need every day, and any tips for sneaking it in?
that's a tough one.
Yeah.
Yeah.
I don't think there was an amount specifically that anyone had mentioned, so I don't really know exactly about that. I think any amount is good. So if you can, I mean, I think the sourdough is great. Yeah, some of them are pretty strong tasting, so I understand that it's not for everyone. Yogurt, I think, is an option. The dairy question is a little bit controversial with the whole ACLM. So they didn't talk too much about dairy, but to have enough calcium and vitamin D and protein, a lot of people do think that dairy is something you can add in, low-fat dairy or healthier dairy options. So yogurt's an option for fermented foods. But if there's one or two you like, I think that's fine. You don't have to have more than one type necessarily.
Yeah. No, I think that's great. And I think the important thing to remember is that while the fermented foods provide the actual bacteria, it's the fiber that provides the food for the bacteria. So as long as you're getting your healthy bacteria are in there to begin with, you don't need to constantly replenish the bacteria. You just need to feed them foods that favor the healthy bacteria and don't favor the unhealthy bacteria, right? So, okay, that's awesome. All right, let's switch over to exercise for a moment. So I have a couple of questions here. One is, do you recommend mat Pilates instructors who can schedule Zoom workouts for an experienced student? Um, so in other words, like, okay, how does Zoom work out? Is that an acceptable way of getting training? These days, a lot of people do these things by Zoom.
Yeah, I mean, I think, mat Pilates I mean, that's at home, obviously not the reformer, but I think that's really does do a lot of strengthening of the core. Um, so I think that definitely counts. I mean, and probably does some strengthening of your whole body. So I think that definitely is an option for the strength training piece. I think in terms of recommending instructors, I don't think it's really more word of mouth. I think talking to your friends. I think at Lown, we don't necessarily have specific places that we're recommending for mat Pilates. So,
Okay, great. And somebody wants to know, Lillian, what is your workout? And I think I kind of don't want to hear it because I know it's going to put me to shame, but
no,
tell
no.
us.
I go to a gym that's local to me that is a small, kind of runs small group strength training exercises, and it's run by a physical therapist actually. So I go there about 3 or 4 times a week. So I get my total body kind of strength training that way. And then I like to do yoga for balance and for stretching. I think that's really important also as we age to include some sort of multimodal exercises, and yoga is great for that because it's body weight strengthening, but it's also balance. So I like to do that once or twice a week and then really get in some cardiovascular exercise. So when it's snowing out, I have a treadmill downstairs that I can kind of, listen to a podcast or some music and get a workout in. But it's a constant like work in progress, constantly checking in with yourself and really kind of looking at where you might need to increase something or decrease something. So that's my workout.
It's a huge commitment.
Yeah. Yeah. And I think the other piece is that I've learned that I have to schedule it in. So it has to be part of my week where I know that this hour is dedicated to exercise. Otherwise, other things will take over. I think we all lead pretty busy lives between family and work commitments, our own things that we have to get done in the house. And so if it's not scheduled in, I think it can really just drop to the bottom of the list. And so for me, my strategy, that holds me accountable is I know exactly what I'm doing most days of the week. Obviously that changes for, change in season or, if you're traveling, but really at least having that core, I think is important to be compliant.
Great. Harley, what about you? How do you manage the exercise? Got little kids at home.
Yeah, I think COVID changed my exercise routine. So now I do Peloton. I used to go to a gym, but I stopped that during COVID, and I really like the Peloton. I think variety for me is the most important thing. So doing something a little bit different every day and focusing in a week, in the course of a week, doing the bike once or twice, the treadmill once or twice, full body, upper body, lower body, yoga, like just trying to keep it interesting. And I really respond well to music and exercise. So I've always enjoyed exercising more when there's good music. So you can choose, what playlists you like and go from there. So I find that helpful.
Nice. Thank you. I'm old enough to say that I don't do anything I don't enjoy doing. And I think for a lot of people to maintain a schedule like that, you have to actually find something you like. And I have a lot of patients who dance, they might go to a line dancing or they might garden or they might do yoga. That's my personal favorite. But I think that trick of finding something that you can do, work it into your schedule and be flexible, but also something that you look forward to. So you're not always looking for an excuse not to do
Yes.
it.
Yes. The best exercise is the one you will do.
Yes. Okay, now here's a question that's about sleep and stress and exercise. There's a few questions about wearables. So someone has a Fitbit, someone has an Oura Ring. The person with the Fitbit says they're not getting a lot of REM and deep sleep. Is that accurate, first off, and is there a way to improve that? And the Oura Ring person says that the Oura Ring is telling them their sleep and stress need attention. How do you integrate this info into your improvement strategies? What do you do if it's telling you you're under stress based on the biometrics? Is it reliable? And how is that helpful? Maybe Harley, you want to start and then Lillian chime in.
Yeah, I mean, I think these devices are relatively accurate, but obviously there's some false data we get. I think it's just one of the many tools we can use in addition to vital signs and symptoms and a lot of other things people are feeling to know that maybe there's something we need to be addressing or focusing on. So it's a good jumping off point to think about, could this be real? And then if it is, what do we need to do to investigate it further? I don't know the exact data on how accurate these devices are for sleep. I'm sure they've compared it to a official sleep study, but I don't have that data. But I think a lot of times they do indicate maybe something, maybe not the exact results that are showing up, but that something could be a little bit askew. Yeah.
I think they do have a hard time distinguishing between REM and deep, but
Mhm.
that if you lump the REM and deep as sort of the restorative sleep, it is fairly accurate. Lillian, were you going to add something?
No, I mean, I have an Oura Ring
And
and
I
I
have a
find
Fitbit.
actually and you have a Fitbit, yeah. So when I look at look at how it analyzes my nighttime sleep, it feels pretty accurate to me. So and I think on the days that you're not restored or it needs attention, I think you kind of know it. And then it might, in the app itself, it gives you some things to think about. So, did you eat late? Did you have alcohol? Are you stressed? I mean, there are kind of suggestions in there. But I think if you're having kind of these sorts of signals from your wearables, then I think come in and see your PCP, and then we can kind of actually really look through each of the pillars and kind of figure out where there's a place for improvement. So, I like the information. I think it's helpful. Um, and yeah, so
No, I think they are helpful as long as I think, as Harley, as you were sort of alluding to, it doesn't become another source of stress. It's really intended to help you figure out, oh, what does alcohol do to my sleep? Actually, I thought it was helping, but it's really maybe not. Or do I sleep better after exercise? But so many of the wearables these days, the continuous glucose monitors can also help us just to, maybe you wear it for a week, but you learn about what kinds of foods trigger your sugar or stress triggers your glucose. What does exercise do? So I think, we're living in kind of an interesting time where individuals can obtain so much information about their own bodies. But again, to emphasize that we're here to help you make sense of it. It's not necessarily something you can just look up and figure out on your own. And somebody was saying that meditating helps with quieting the mind, helping with sleep, and there are lots of free good guided meditation links. So we didn't really talk about the stress and meditation, but are there any meditation tricks that you guys have for people if someone's just a beginner?
I mean,
Apps?
I think, yeah, the apps, I think, Calm, 10% Happier,
Yeah,
I think using some of those apps to help you with meditation, because I think that's also a practice and it really is, it just doesn't happen. I think we really have to dedicate time to it and just, but I think there's so many tools available now online, so many apps. So I think we have a lot of support to kind of increase our skills. So.
great. All right, thank you. I'm going to switch back to nutrition for a little minute here. What about probiotics? Is that something that people should be taking?
That's a good question. I mean, I think for some people, they're very beneficial, and which people those are is not always clear. The Some studies have shown that in people with irritable bowel syndrome, probiotics are especially helpful. So, if someone's struggling from a GI standpoint, I really do try them, but with the knowledge in mind that it's not always perfect for everybody. But I do have patients who really see a great benefit from taking them, and so I continue them. I think the studies are mixed in terms of, do they help with immune system, fighting illnesses? Do they help with your GI function? It seems to me that it's not totally clear. Like it's not a one size fits all and it doesn't help everyone, but I do try them often. I think in people taking antibiotics, I always recommend taking a probiotic during that period of time, not at the same exact time, but spaced out by a few hours because antibiotics really are the one thing that kills that microbiome like nothing else. So I think it's worth it to try to keep the microbiome healthy if we can during antibiotic usage. And that is a time when I find them to be helpful.
Great.
Yeah, I feel the same way that really it's with patients who use antibiotics to use the probiotics. Um, so I think it's hard to replicate what we get in nature and in our diet and in the soil. And I think, the soil has changed and, depending on what, where you're getting your vegetables from and how much healthy bacteria is in there and how do we replicate that and how do we do the studies? So I think it's really hard to do those studies and really uh, kind of get the right evidence to kind of recommend one way or another. So
Yeah,
challenging.
good. I think it's sometimes these buzzwords get out there and marketing gets a little carried away, and it's not all probiotics are created equal, not all fiber supplements are created equal. So I think, again, this is where it's helpful to have a little bit of, you know, PCP guidance when thinking about these things. Someone is asking whether we should be testing for, how do you feel about testing for patients' vitamin and mineral levels? And if the values are out of range, do you recommend supplements? Why or why not?
Yeah, I mean, I think that one of the downsides to a plant-based diet is that sometimes you don't get enough of certain vitamins. So notably vitamin B12, sometimes iron, calcium, vitamin D, sometimes zinc. So that is one of the few downsides of a plant-based diet is that vitamins are sometimes deficient. So there are certain vitamins depending on people's diets and other factors I'll check for. So B12 levels, vitamin D. And I think that those do sometimes need to be supplemented. Very few people probably need like a full everything in a full multivitamin. Like a lot of those things you probably are getting enough of in your diet, but there are certain ones depending on your diet that we do want to be monitoring and supplementing if needed.
Lillian, did you want to add anything to that?
Yeah, no, I think that, in some instances, for B12 and vitamin D, there's reference ranges of, what our targets are. So in that instance, we can really kind of tailor it. And yes, we do measure and we look and we advise on supplements if it's low. Um, but like, for example, magnesium or calcium blood tests don't correlate with sort of what your needs are necessarily. So
Yeah.
in certain conditions, obviously magnesium, if it's low, we're gonna supplement it. And if you're taking certain medications that might inhibit the absorption of vitamins, so looking at your diet, looking at your med list, and then really sort of thinking about what you might be at risk for having a deficiency, and then going from there. So.
How about for people on GLP-1 agonists? Are there any nutritional concerns we need to be aware of for them?
I mean, my big thing with GLP-1s and anyone who's losing weight is really just prioritizing healthy protein,
Yeah.
so that you can really protect the muscle from the effects of weight loss, and that you're really targeting more your fat stores for weight loss as opposed to muscle. So, but I think that that's really more of my focus with GLP-1s.
The protein.
Yeah.
Okay, great. And I would emphasize for our audience that we are working with a group called Palm Health, who has a virtual dietitian nutritionist pairing one-on-one with you to help you with some of these questions. And so while we won't be able to get to all these questions today, and there are some amazing tons of questions in the chat that we're not going to have time for, ask your doctor, and we can make referrals to Palm Health. It's going to either be, if you're on Medicare, a small copay or even covered altogether. And it's a really it's kind of a fun way. They did a webinar with us last month that if you've seen it, they're very much about enjoying food and finding ways to get your diet to be healthy and fun. So I really recommend that too. It's a lot of questions out there. Okay. Let me see. So someone is recommending tepary beans for soluble fiber, protein, calcium, making hummus and dips. And someone else is saying, I would like to eat more protein in whole foods, but sometimes the taste or texture isn't palatable. Suggestions for good tasting alternatives. So again, I would love to hear what you guys have to say. I know that sometimes, even though we want to do the right thing, it's hard to find sustainable, enjoyable ways to get all these healthy eating habits into our diet. Any hacks for that? So I would refer the person asking about palatable foods to the person who's talking about these yummy beans and dip. Any other hacks for that before we wrap up?
I think we were talking about the challenge of getting enough protein in the plant-based diet, and then if you don't tolerate beans and lentils, that it can be a little bit more difficult. So that is definitely a challenge.
Yeah, some of us like it and some of us don't, and our kids may not either. So making it a dip, sneaking it in a smoothie, those things can work. But how about you, Harley? You've got kids. How do you get them to eat their fiber?
Yeah, I definitely hide it in things. Making pesto with half spinach, half basil is a good way to get some spinach in. Smoothies can really take a lot of things without really tasting them. So those are good options, or finding different ways to cook things like tofu or tempeh or things that the texture may not be quite right. There are some different ways to crumble it or to air fry it or, different techniques that can sometimes make it taste a little different or maybe have a little bit of a better texture. So there's a lot of ways. I think Palm Health is good at helping with that too. So that's another thing they can work on.
I agree. And I think New York Times Cooking has had some really good healthy recipes. Every New Year's they start going around with some healthy hacks as well, and they're pretty straightforward. All right, gosh, it's 3:30. So I would love to keep going with this conversation, but I'm afraid we're out of time. So I would love to just thank our audience for this incredible engagement and all the wonderful questions. And thank you both for sharing your expertise. I think we've talked about so many things. We've covered the 6 pillars of lifestyle medicine: sleep, stress, exercise, I'm going to mess them up, nutrition, substance abuse, and social connection, and the ways that they all interact together to help improve not just our heart health, which is near and dear to my heart, immunity, inflammation, cancer risk, longevity, and well-being and feeling great. But with all this information that's coming out and lots of new information coming out all the time, I would say when in doubt, talk to your PCP, talk to your cardiologist, and we're here to help guide you through this information overload. So thank you all. Stay warm, stay dry. And for those of you who would like the slides, several of you asked, just shoot an email to info@lowngroup.org, and we'd be delighted to share the slides with you. So thank you again, and have a great day.
Thank you.
Thank you.